Mr. Chairman, ladies and gentlemen, good evening. I've been called a lot of things in my time, and coming from Glasgow, "Hey you" was one. In Japan, Dr. Viagra. And tonight, an international drug peddler. My mother would be so proud. However, I find it slightly ironic that we are having this debate in this building of worship. And the two gentlemen on my right, the high priests of no treatment, would have you believe that well-researched drugs are no more effective than placebo. In fact, as Mr. Self said, they are nocebos. They're no damn good, but they cause side effects. And it's pharma that's the cynical purveyor of these. I'd like to say this does a disservice to our patients. And I, as a physician, care about patients. I also care about the science behind drug development. So the SSRIs are placebo. What is psychotherapy? Why is talk therapy so much more acceptable than drug therapy? Is this the zeitgeist that we're in just now? And why is it that psychotherapy has actually lost ground to pharmacotherapy or drug therapy? Simple. It's just the power of pharma. We spend loads of money advertising, putting reps out there on the street to beguile unsuspecting GPs, prescribers, and indeed patients with, in the US, direct-to-consumer advertising. I don't think it's quite like that. Depression, ladies and gentlemen, is a killer disease. At least as toxic as some of the diseases it coexists with: cardiovascular disease, cancer, arthritis. Antidepressants do work. I will expand on this in a bit later. Studies over the past 30 years actually show that they do. There has been a huge increase in psychotropic drug prescribing. That's antidepressants, anti-anxiety agents, drugs for psychosis. And it's not just down to pharma marketing. It's far more complex than that. And I think it does a disservice not only to the medical profession, but also to the patient population, of which I'm sure many of you are or have been a part. Mental illness is a prevalent phenomenon. 1 in 4 Europeans, and probably up to a half of patients, will meet the criteria for a mental health disorder in their life. A staggering statistic is 20% of children in the UK will have a mental health disorder in the current year. This is not pharma going out and saying, diagnose more patients, we need the money. It's nothing to do with that. Depression and schizophrenia are malignant conditions and attract with them more than a doubling of the mortality, the death rate, just associated with the diagnosis. And counter to the discussion that we're overdiagnosing, I think we're actually underdiagnosing serious mental disorder. And I think it requires not just the minute it's diagnosed, treat it with a drug, not at all. Diagnose it first and treat it appropriately. And also the economic consequences to the country are ridiculous. Apparently it's costing up to £90 billion a year, not just in patients' loss of cost of quality of care, but also cost to the economy. I don't really understand why there is such an opposition to detecting mental disease. You may also hear and have read writings of Mr. Self, which talks about the placebos that we're purveying in the pharmaceutical industry. And we will quote meta-analyses, these large analyses of many, many studies, which when you run the numbers say, they're not much better, these antidepressants, than placebo. Well, there are limitations to the way those studies are put together and the interpretations put in them. But I would say that, wouldn't I? But I can go into further detail about it. There are eloquent protagonists for drug therapy, which actually say it's as good as psychotherapy, not it's as good as placebo, it's as good as psychotherapy over the first 3 months of treatment. I did a study some years ago in the UK looking at patients who were put on a drug you might know as Zoloft or Lustro called sertraline. We treated them for 8 weeks. And after 8 weeks, those that responded to the antidepressant, we allocated 1/3 of them to placebo. There was a substantial relapse on placebo, whereas the patients maintained on active drug maintained themselves in a non-depressed state. If that is a placebo, what was placebo? I don't understand what the accusation is. I'm not against psychotherapy. I think what we have to advocate for is the right drug for the right patient at the right time. I'm not against adequate research, but what I am against is a biased view of the world which misleads. There's no blood test for depression, and nobody said we've found the cause for it. We don't actually mean that if we give an SSRI, your problem is serotonin deficiency. That was a naive and simplistic view put forward many years ago. What we are saying is we don't understand the cause of depression, and we don't fully understand the mechanism of action of antidepressants. But we do know that the modern antidepressants are substantially safer and better tolerated than the older ones, such as the tricyclics, amitriptyline, protriptyline, etc. These drugs do work. The GPs are overprescribing. That's the problem. Blame them. Blame them because they go to drug lunches and they have a rep in the door who says, I'll give you a pen if you prescribe. That does a hell of a disservice to our GP colleagues. It's not like that. There has been an increase in prescribing, and that can also be due to the fact that there are smaller prescription sizes and patients are being treated for longer. So there is an amplification of the number of prescriptions given out. But there is also, I would call it, a societal drift. I think there's a demand from the patient population to go to the GP and get a treatment. We go to the GP for a treatment for a sore throat. If we don't get an antibiotic, we're actually not very happy. But it's a virus, you don't need an antibiotic, and it takes time for the GP to say you don't need an antibiotic. And the GP is responsible for prescribing. He is to prescribe responsibly. I do believe that the GPs are doing a good job in the face of tremendous stress and overwork. It doesn't mean to say you do bad medicine. You actually have to treat patients well. Also, I think the pharmaceutical industry is not doing such a bad job either. It spends a lot of money on research and development. I also like to know where the drugs are coming from that are going to treat the dementia that will afflict some of us in years to come. Who is going to help develop vaccines for Ebola? The ones that are making the excessive profits prescribing SSRIs, perhaps. I hope when you leave here tonight that it's not just simply a case of expensive placebos, pharmaceutical companies prescribing, it's bad for you. Actually, it's good to detect depression, it's good to detect anxiety. And I nearly detected a case of anxiety tonight. My colleague and friend, Professor Simon Wesley, said, I'm quietly going mad here, as he couldn't find his script for the speech. And I thought, maybe I should give him a Valium. But then I thought, no, I won't. So in summary, ladies and gentlemen, there's a lot of complexity in this system. I do believe that, as Mr. Self says, there's a lot to do with feelings here. we're not here just to treat feelings. We're here to treat disease.